The end of Maryland's stay-at-home order had many of you outside to enjoy some of the great weather that we had, your favorite pastime over the weekend. But one activity people might still avoid has healthcare providers troubled. As part of our Rebound Maryland series, our Mark Roper spoke with a doctor who is concerned about the number of people staying away from seeking emergency medical treatment.
Hospitals put elective surgeries on hold for weeks because of COVID-19, but doctors worry the virus also has many patients purposely avoiding hospitals and ignoring symptoms.
Particularly with heart disease, if you put those symptoms off, you're risking a bigger heart attack and increasing your risk of dying from that heart attack.
University of Maryland School of Medicine Associate Professor Dr. Mark Vesely says healthcare officials nationwide report a significant drop in the number of emergency room visits for heart attacks or strokes.
And people coming in late where they've had symptoms, for hours, days, weeks even, where they've tried to kind of push them off and not want to believe that they're heart attack symptoms, and then coming in late and getting sicker because of that.
Dr. Vesely describes some of the symptoms of a heart attack include chest pains, shortness of breath, or sweating for no apparent reason, while stroke symptoms can be remembered by the acronym FAST. F is for facial droop, A is for arm weakness, S is for slurred speech, and T is for time, as people experiencing these symptoms don't have the luxury of time to wait and get help.
Time is muscle. The longer you sit on those symptoms, the longer that your heart is deprived of that blood flow, more damage is done to the heart, and ultimately that costs people lives. And I know of patients specifically that have ultimately passed away, and having family members come back and say that they did try to ignore symptoms.
So if you have questions about your health, call your doctor.
And even if we don't have an ability to set up a video conference like this, just calling into your doctor's office and getting a hold of somebody, even if it's 2 a.m. and you get someone who's on call, being able to talk over your symptoms and ask those questions can be critically important.
Meanwhile, Dr. Vesely says hospitals will separate patients who have COVID-19 symptoms and concerns from those who don't, starting at the emergency room door.
And that translates in the hospital throughout different procedures in different hospital floors and wards, so that we are doing everything we can to keep people safe.
Mark Roper, WMAR 2 News.